Nasal airway volume and craniofacial morphology, orthodontist's perspective. Normal respiration is believed to involve adequate utilization of the nasal and the nasopharyngeal tracts. Unusual enlargement of structures within these anatomic areas, such as adenoid tissue within the nasopharynx and nasal turbinates within the nasal cavities, could cause an impediment in the passage of air within the nasorespiratory channel. If the obstruction is of sufficient dimension to preclude nasal respiration, the result may be an adaptation to an oral mode of respiration. As of late, it has come to be realized that an oral mode of respiration causing postural adaptations of structures in the head and neck region could have an effect on the positional relationship of the jaws and on the developing occlusion. With the latter as a prevailing philosophy, orthodontists have begun to see more problems in dentofacial development seemingly related to the necessity of an oral mode of respiration. Therefore, it has become necessary for orthodontists to examine the nasal and the nasopharyngeal areas and to evaluate the effects of obstructions in these areas on dentofacial development. Methods to evaluate the nasal airway in orthodontics began with the lateral cephalogram. However, two-dimensional cephalometric radiographs do not give a clear visualization of the nasopharyngeal area. With the advancement in the diagnostic field, the advent of CBCT has opened the opportunity to evaluate the cross-sectional area of the airway as well as the volumetric 3D depiction of the entire airway using a lower radiation method than medical CT with a rapid scan that is non-invasive. Introduction. Measuring nasal airway volume is important for understanding how well the nose functions, especially in people with certain facial structures that may affect breathing. Traditional methods like X-rays or acoustic rhinometry, a sound-based measurement, have limitations. They can't fully show the nasal cavity or accurately measure its back portion. Computed tomography, CT, scans provide detailed 3D images but expose patients to higher radiation and are expensive. A newer technology, cone beam CT, CBCT, offers a safer and more affordable way to create 3D airway models with lower radiation. Advanced software, like Dolphin 3DR, helps analyze these images, allowing doctors to measure nasal volume and assess breathing issues more precisely. This is especially useful for orthodontic and surgical planning, as facial shape variations, such as a small jaw or enlarged tonsils, can impact airway space. This study explores whether different facial types have different nasal volumes, using CBCT to provide clearer, more accurate measurements. By improving how we assess nasal airways, doctors can better diagnose and treat breathing-related problems. Discussion and conclusions. This study explored whether the size of the nasal airway is linked to different facial shapes. While past research focused on throat, pharyngeal, airways and breathing problems like sleep apnea, this study examined only healthy individuals, ages 18 to 28, to see how natural facial structure affects nasal volume. Using 3D imaging, CBCT, subjects were grouped by face shape, broad, euryprosopic, average, mesoprosopic, or long-narrow, leptoprosopic. Surprisingly, nasal volume was similar across groups, though slightly smaller in narrow-faced individuals. This may be because narrow faces often have more protruding noses, balancing out the volume. The study also checked if jaw alignment, class I, II, or III, influenced nasal size but found no strong connection. However, wider faces did correlate with larger nasal volumes. To measure nasal space, researchers used semi-automatic 3D software, Dolphin 3DR, which proved more reliable than fully automated methods. While results weren't statistically strong, they suggest facial width, not length, plays a role in nasal size. Future studies with larger groups could clarify these links, helping orthodontists better understand how face shape impacts breathing. This important article is authored by the following scientists. Thank you for watching this video. Please subscribe to our channel BP International to watch more videos in the fields of science, technology and medicine.